This is a plain CT scan brain of a 28 years old male patient who met road traffic accident couple of hours ago. Please see the fracture lines involving anterior and posterior walls of right maxillary sinus, hemosinus in right maxillary sinus, multiple fracture lines involving right zygomatic arch with significant depression and overlapping of bone fragments. Fracture lines involving right lateral wall of the orbit, slight diastasis at right frontozygomatic suture, air lucencies are present in the anterosuperior part of right orbit, soft tissue swelling in right periorbital region. Please observe diastasis of left limb of the lambdoid suture. It extends downwards. Now there are multiple fracture lines involving left mastoid, like this fracture here, this one. As I trace it down, hemorrhages are present in left mastoid cells, left middle ear cavity. This is a fracture line involving left tympanic plate. Please see this fracture line here involving lower part of the left mastoid, intrasinus hemorrhages, the hemorrhages in left middle ear cavity. This is another fracture line here which courses downwards. It has involved lateral wall of the carotid canal, this one. Then it involves the lateral wall of left sphenoidal sinus, septum, and left lateral or the medial wall of right sphenoidal sinus. This is the brain window. Please see hemosinus involving right maxillary sinus, both the sphenoidal sinuses. Hemorrhagic contusions involving right frontal lobe here. Areas of mixed attenuation containing hyperdense areas. These are the hemorrhagic contusions. Now, density of left segment sinus and transverse sinus, these are increased. So the possibility of these being partly thrombosed cannot be excluded. Air lucencies are also present in the segment sinus. Now this is an extradural hematoma here. This one, it has crossed the left limb of lambdoid suture. Normally the extradural hematomas do not cross the sutures, but if there is sutural diastasis or fracture line extends across the suture, then these do extend across the sutures. In children, such adherence of the dura at the edges of the sutures are not strong, so in cases of children, these may cross the sutures even when there is no sutural involvement, or there is no fracture which crosses the sutures. So it is an extradural hematoma here which has crossed the left limb of lambdoid suture. Air lucencies are present inside this extradural hematoma. There is a hypodense along the outer surface of left temporal and parietal lobes. This is subdural hygroma, which is a post-traumatic effusion here. Please observe this linear hyperdense shadow above right tentorium. This is suggestive of subdural hematoma. Please observe the thickness of the left tentorium while that of the right tentorium. This is suggestive of subdural hematoma above right side of the tentorium cerebelli. Please, this is the subdural hygroma on left side. This is extradural hematoma on left side. Please see the increased thickness and density of lateral part of left transverse sinus and the sigmoid sinus. These represent thrombi in the sinuses.